Hi, this is Sarah from the Centre for Mental Health, and I hope our friends are doing well in this heat right now and staying hydrated. We thought we would talk to you about all things mental health, and this week the emphasis has been on children and young people, as the government have published their response to the feedback that they received through their green paper consultation process, which we fed into, as did so many other organisations and individuals. I think that, certainly we have welcomed many of the commitments made by the government this week. So we welcome hugely the emphasis on making schools more mental health friendly. And what I mean by that is really making sure that teachers have the resources in which to think about mental health and building resilience in children. So mental health on the PHSE is absolutely critical for sure. I think we welcome the focus on mental health leads in schools. I think we have for some time acknowledged and recognised that schools are wondering what to do, making sure that they have access to the right resources at the right time. And sometimes you need a person in post who has kind of an expert or a sole focus on these issues to make it sensible for people. So we welcome that. We also welcome the emphasis on waiting times for children who do need specialist help. We have all heard stories, haven't we, about children getting very, very ill and not being able to get help quickly enough. And we know that if people don't get help quickly enough, it takes longer to recover and it's harder to rejoin your life. And I think that, of course, for children and young people, what we want to do is be able to get them into help, return them to their lives and help them to thrive beyond a period of crisis. So good news there. I think that the thing that for us as an organisation that's also important is actually some of these commitments are not going to address the issues of inequality. They're not going to address the issues related to the 120,000 children who are homeless right now, or the impact on, the mental health of some of the poorest children and families in our society. So I think from an organisation's perspective and from a personal perspective, our concern is, how do we make a difference across the system? We certainly don't believe that one source or one strike is going to attend to the decline in children's mental health. We don't believe that social media invented mental illness. We don't believe that school alone is the solution, although we know that exclusion from school, for instance, is a lifelong trauma. So what we're saying is that we urge the government, we urge our partners to make sure that we don't put all our eggs in one basket, that we think that that we need to look beyond just one aspect of the system. Children's lives are complicated, and I think that we need to understand what their experiences are. We need to understand what their challenges are. And I think that, if you're a child growing up in a household that's really, at the kind of coalface of austerity or in poor accommodation, PHSE alone is not going to address that level of inequality. So we welcome some of the commitments, but there is so much more to do. And I think that certainly we at the Centre will continue to highlight those factors. So stay tuned, look at what we're saying, follow our Twitter and Facebook and LinkedIn platforms, and we will be letting you know what we're saying over the coming weeks. Take care, have a good weekend.